Good morning and welcome back to GP Video Podcast by Nadia. Today we will again be talking about fatty liver because we spoke about it a few days ago and then I went on to the other topic so that things don't become so boring. So we are going to go back to fatty liver because I can't finish any topic in a 3 to 7 minutes video, but I can just touch 0.00001% of them. Okay, so what is fatty liver disease again? Fatty liver disease describes a range of conditions caused by an accumulation of fat in the liver. The disease affects about 10% of Australians and is the most common reason for mildly abnormal liver function results. It rarely causes pain, does not cause nausea or fatty food intolerance, but sometimes can indicate, when it is there, it can indicate that you've got other health problems. So what happens is usually fatty liver is diagnosed as an incidental finding because it does not usually cause any kind of symptoms. So whenever you're getting the blood tests done for maybe some other reason or for the general health checkup, then mildly abnormal liver function tests, if they are there, they usually indicate fatty liver. What causes fatty liver? Again, fatty liver is not caused by simply eating fatty foods. It is associated with health problems such as, so there are four main causes of fatty liver. Obesity. About 20% of people considered obese have fatty liver disease. So 20% of obese people do have fatty liver disease. Number two is high cholesterol, high blood cholesterol and triglycerides. Number three is type 2 diabetes mellitus, and in some cases serum insulin resistance, like the people who are insulin resistant but are not type 2 diabetic yet, they can also have a fatty liver disease because these people are usually obese anyways. And then heavy alcohol use. So four main causes are obesity, high cholesterol, type 2 diabetes mellitus, and heavy alcohol use. There are some other causes like hypothyroidism, certain medications, polycystic ovarian syndrome, and complications late in pregnancy. There are talks that there are some genetic or familial factors involved as well, but not sure. Okay, now what is NAFLD? So that is non-alcoholic fatty liver disease. So basically fatty liver disease can be divided into two main categories. One is alcoholic fatty liver disease and one is non-alcoholic fatty liver disease, or NAFLD. It is the most common kind of fatty liver disease, which is non-alcoholic fatty liver disease. It can result in liver damage, especially if fat accumulation in the liver progresses with inflammation. And when it progresses with inflammation, it is called NASH. NASH is non-alcoholic steatohepatitis, which is inflammation of the liver. NASH is a chronic disease in which accumulated fat in liver cells cause liver inflammation. The condition very slowly gets worse and is more likely to be a problem if you also have another liver disease such as hepatitis C or B, or if you drink too much alcohol. So again, it is non-alcoholic steatohepatitis, but if you once you get it and then you are drinking alcohol as well, then it will just complicate the issue. In some individuals, NASH may gradually progress to scarring of the liver and to more serious chronic liver disease such as cirrhosis. So though fatty liver is a benign condition, is an innocent condition, but then if you don't treat it on time, then or the causes of it basically, if you don't treat the underlying causes, which we said there are four main and there are some others as well, if you don't treat the cause, then it can slowly develop into inflammation and then scarring of the liver and finally liver cirrhosis. NASH typically occurs in people who are overweight and diabetic with high blood cholesterol and triglyceride levels. So when I said that these are the four main causes, which is obesity, type 2 diabetes, high cholesterol, and alcohol use, basically you can have any one of them, any two, three, or all four of them. And the more you have the causes, the more worse fatty liver is and the more quickly you have to act on it, because usually people who are obese can have insulin resistance and type 2 diabetes, and usually they have high cholesterol as well, and if they are alcoholics as well, then it's going to be like an icing on the cake. You should therefore minimize or control as many as possible of these risk factors. How is fatty liver diagnosed? Because fatty liver does not usually cause pain, nausea, or fatty food intolerance, many people do not realize it until they have a routine blood test which suggests a liver problem. If this happens to you, your doctor may organize an ultrasound scan of the liver to check for fat. Because usually when my patients have mildly abnormal liver function tests, either I repeat the bloods after 3 months, or if they are concerned or I'm concerned, then I'll just get an ultrasound scan to see whether it is fatty liver, and especially if they have the risk factors, just to make sure it is fatty liver, and then we'll work upon those risk factors. So a liver biopsy may be suggested, but this is rarely necessary. I don't think a liver biopsy is the way to go, because liver biopsy might only be done in the conditions when there is a scarring or liver cirrhosis. And then what should you do if you have NAFLD or NASH? What is the treatment? We will touch this topic in the next video.